Welcome to a brief overview of frozen shoulder or adhesive capsulitis, which it's also called. Frozen shoulder is a condition which affects the glenohumeral joints, the shoulder joint, the main shoulder joint, which is the joint between the glenoid, which is the cup, and the humerus, which is the ball socket joint that goes into it. Now, frozen shoulder is a condition whereby you get a contraction of the soft tissues around the shoulder, particularly the capsule, which is like a bag that sits around the joint, and I describe it as it almost being shrink wrapped to the joint. So where you'd normally have mobility and flexibility, it's quite a loose capsule to allow the movement you've got in the shoulder. With a frozen shoulder situation, it becomes sore, then it becomes restricted. So the fact you can't then move that shoulder. In certain positions, reaching up the back becomes very difficult. Women reaching to the bra becomes impossible. Even getting under the armpit becomes very, very difficult or impossible. And movements in this position here, where you take the arms out, becomes very, very difficult. Eventually, every movement becomes difficult and painful. It's a very common condition that we see in clinic, and if it's managed well, it can really help to reduce symptoms. So early stage, you want to make sure you're keeping it moving, take appropriate painkillers, possibly anti-inflammatories. As it gets stiff and sore, then it's trying to push a little bit more into range to try and retain as much range of movement as possible. And once it becomes less painful, then you can start pushing it a lot more to regain the range. It's worth discussing it with an MSK physiotherapist because there's lots that can be done and lots of things you can do yourself to help. We've put some good resources on the site. Please do have a read of that, and hopefully that'll be helpful.